allow me to tell you about the history of critical care. The scene. 1850s, the Crimean War. There was a mortality rate of 40%. For every 1,000 soldiers that went into battle, 400 died. And along comes Florence Nightingale, the mother of modern day nursing. Although which bothers me because she did so much more than that, not that that isn't already an accomplishment in its own, but she in and of itself came up with the concept of increased sanitation, increased hygiene, increased nutrition, and the way that she actually started the ICU, and somewhat could be the mother of the ICU as well, is she actually learned how to group all the sickest patients together in the wards so that they could all get the medical attention that they needed. She also started nighttime rounds, which we're okay about. By the end of the Crimean War, after Florence Nightingale took over, mortality rate went from 40% to 2%. Now, nothing happened until mid-1920s, and the father of neurosurgery, i.e. Walter Dandy, started the first post-neurosurgical recovery unit at Johns Hopkins Hospital. He also invented the brain team, which was a specialized group of nurses and trainees that were specially trained to help monitor and manage the difficult post-neurosurgical patients. Now, of note, these residents were constantly on duty for 50 weeks out of the year, being allowed 2 weeks of vacation. There were no nights or weekends off, and residents could go as many as 3 months at a time without ever leaving the hospital. Quote, "Luckily, we had a barbershop in the hospital." Martin Kirchner, another surgeon in Germany, then copied this idea and created post-op wards. And then during World War II, we had battlefield shock trauma units. And then the 1950s happened, and Copenhagen was hit with the worst polio outbreak in history. So Bjorn Ibsen took Nightingale's idea and grouped all of the sickest patients together into one room so they could get the specialized care that they needed so much faster. He also invented ET tubes, i.e. endotracheal tubes for the layman, as well as cuff tubes, and further advanced the whole concept of a tracheostomy tube. Now, I will never complain about my job again because these residents that were working along with him handbagged their patients for the entirety of their shift. After these implementations, mortality from polio dropped from 87% to 31%. And that is how the first ICU was born in 1952. Now after that, the expansions of the ICU started happening pretty rapidly. So in 1958, Max Harrywell, i.e. the father of modern intensive care, established a 4-bed shock ward at Los Angeles County / University of Southern California Medical Center in the USA. That same year, i.e. 1958, only 6 years after the first birth of the ICU, Dr. Peter Safar, i.e. the father of CPR, opened a multidisciplinary ICU at Baltimore City Hospital, which was the first ICU to have 24-hour coverage from physicians. Now, by the 1960s, we had the birth of dedicated ICUs for both medical and surgical patients. And in fact, in 1964, Colorado General Hospital instituted the first respiratory service, which means that we had a group of physicians that would round on all of the respiratory services, i.e. the iron lungs at that point in time. Now, initially all the units were open and the intensivists were just consultants. Then they realized that many ICU patients had similar problems, i.e. ARDS, needing mechanical ventilation, shock, pressor requirements, etc. And so they formed more closed units. In 1962, the first critical care residency was established in the US at the University of Pittsburgh. In 1970, the Society of Critical Care Medicine was formed, and in 1980, critical care medicine was recognized as a subspecialty in its own right. Some more fun dates for you. The first microprocessor-controlled ventilator was developed in 1971. The first pulmonary artery catheter was invented in 1970, and the first successful use of a heart-lung machine was on May 6, 1953, i.e. the precursor to ECMO. Some more fun facts about how rapidly ICU has been continuing to grow. Halpern and Pastors published an analysis of the expansion of the ICU from 2000 to 2005, so over 5 years. And there was a 7% increase in ICU beds, even though there was a 4% decrease in total number of ICU beds. And the cost of critical care medicine increased by 44%. Even to this day, critical care medicine is regarded as one of the fastest growing medical fields in terms of patient numbers. Obviously, having a respiratory pandemic did not help that cause. All of this to say that since its birth only 70 years ago, the field of critical care medicine has grown exponentially. For better or worse, we are getting exponentially better at keeping people alive. Thank God for all those people though, because I love my gig. Anyways, I could nerd out about this all day, so please tell me what else you guys want to learn about so that I can have a chance to geek out. Okay, thanks. XOXO.